Okay, hello, IEI Superintendents members. How are you all? Everybody listening on the podcast, welcome back to Talk Supes. I am here with Dr. Rob Darzynkiewicz, who is the Chief Medical Officer for Hazel Health, a great partner of IEI's, and we're here to do some follow-up on. Let me set the stage, and then I'm going to introduce Dr. Rob. So, in partnership with Hazel, we put out over our partners Thought Exchange. We put out sort of asking our superintendent members what are the big things you're concerned about with regard to health in your schools and public health when you think about reopening next year. We got some really good questions back, and Hazel and Dr. Rob have provided responses. So we're here to sort of give those responses to the group in audio format. We'll also, Hazel and IEI will be Hazel will be publishing blog posts that IEI has sort of contributed to as well. So we're really excited. So Dr. Darzynkiewicz, thanks for being here. Glad to have you. Can you tell us a little bit about yourself and how you end up in this work?
Sure, Doug. Thank you so much for having me. So, I'm the Chief Medical Officer here at Hazel since we started. Before Hazel, I was the Pediatric ER Director at a regional hospital where I work at the time when we were building the Children's Hospital. At that time with electronic medical records, really found that many of our patients that were coming in did not have a medical home. We're using the ER for their primary care. And meeting these great founders at Hazel and understanding how much education plays a role in a child's as well as a family's health overall, really came that great idea of how can we bring care to children at school when they need it so they can continue their care, continue their education, and have better outcomes.
Great. So education has been part of your practice, and a lot of our districts do find that school is a place to get access to medical care. So it's great that you all are there to help make those connections. So I imagine you've been thinking about this a lot in your role at Hazel. All kinds of public agencies are going to have to open their doors again. Schools play such an important role in the economy. I think that's part of the pressure that our folks are feeling from all sides, because parents have to get back to work. And some of us are lucky in that we can have flexible schedules and do some homeschool stuff. And, I include myself in that privileged group. But for some, they've got to go work on site somewhere. So schools have to open. And all of our members, they're all over the country, they're in different contexts. So can you give me just sort of your high level, big picture thoughts about, if you were a superintendent, what are the things you would worry about right now? And what are the things maybe they could not worry about right now?
Well, thank you. Yes, you're exactly right. COVID-19, we've been living it. I think everyone in the healthcare industry and obviously working with schools, it's been on my mind all the time, honestly, when I wake up to when I go to sleep. How can we, children are going to go to school. How can we keep everyone safe, community safe, but do the right thing? So no, I agree. Everyone's trying. It's been wonderful to meet many smart people trying to figure this all out from there. If I were to take the big high view, and this is what I tell our team is that, we still have limited amounts to know when the virus, right? We have testing, and that's both nasal swabs as well as antibody testing. We have obviously social distancing or non-pharmacological interventions, they like to call it, about, then we talk all about social distancing, masks, washing hands from there. And obviously, you have vaccine and you obviously have treatment, right? And so you have these buckets that, we're trying to figure out how we can best manage them. And so schools are such a challenge, right? I mean, I always tell people, gosh, if this was, if there was a 10-cent test that you could do, you could pick up at the store, like a 20-pack, we wouldn't have an issue. We would be able to test it because we're so limited. And certain counties and certain states all have a different plan on testing. Schools are kind of at this point of what can I do to keep my kids safe?
We none of us think twice about, the standard, vaccines you have to have. Well, most of us don't think twice. You got to have measles and all that stuff. Yep. Right? So we're used to that process. We don't have that yet for this. So, like some of the questions from our group were about, do we have to get everything to zero before we can return to school safely? Is there anything that you can say about the region and the number of cases and, thankfully most places are, I think all places are now past the point at this point where a hospital could become overloaded and ICU beds gone, right? But what are you seeing as the kind of trend, especially, and I know there are all these people out in the streets right now, and that's scaring me in terms of just the amount of people who are maybe exposing each other to the virus. So
without a doubt, no, it's that is a big concern. And the good news, you're totally right. The hospital where I have worked, basically they just broke down their tent today, and we just got a message they broke down their tent because the good news is getting better. The community's having less outspread, but and we have to think of the community and think of what's best. What is the incidence in the community? Is it low? And at that point, can we go ahead and start, increasing our social? We're doing it for restaurants. You're doing it for, for stores. And so now there's a time where when we'll be doing it for schools. And knowing the timeline, understanding that, it takes on average 5 days to get the symptoms, and it takes about, 7 to 12 days to get almost hospitalized for the severe cases. There's going to be, when you open things, we have this 1 to 2 week window to start seeing if things increase. And so you're totally right. I honestly, with my groups, we do a weekly check on all the communities we serve, all the districts where we serve currently. Like, we look at the uptick. Is there an uptick? Is there a chance where that Memorial Day weekend we were all talking about, and you see those pictures in the news, is there now an increase in rise? And so, what we want to do is, districts want to do is obviously keep the community numbers. The health departments, there are many resources out there to look at, see if there is an uptake, to say, okay, there's some more. You know what? These protesters in our community, we haven't seen an uptick in cases, so actually we are looking good. And so that's one way that obviously people can look and see how their community is, because if it is stable and it is low, you're exactly right. It is time to start opening up and start thinking about bringing people back.
Great. So in the responses, that you've given a 6-point sort of guide to what procedures. So prevent spread, practice distancing, reduce exposure, disinfect, wear PPE, enable healthcare access. So this read to me as, well, this is kind of what everybody's supposed to be doing, but let's dive into this a little bit for schools. So are you advising that teachers are going to wear masks and shields and stuff and gloves?
That is a good question. Our advice is every school is going to be different. Every school is going to have different plans based on the community. Yeah, ideally, to be honest, ideally it'd be great to have everyone with that are exposed. But again, if you're reducing your exposure, if you keep the sick kids out, if we're able to prevent children from even entering school who have a fever, who have a cough, who have symptoms, or if a teacher actually has the ability to keep kids out that are sick and immediately identify them, you're reducing your risk. And so, you now can have, you don't have to have less, you can have less, obviously we always want to maximize our reduction, but again, everyone's doing it differently, so at the end, it's a hard answer. I totally agree that, yeah, you picture this nurse, right? I mean, a teacher with a face mask, gloves, and N95 and gloves, like that realistically can't, it's going to be very difficult to happen. And there's not going to be PPEs for that. But again, if we keep a school communities low, we keep kids outside that are sick, a teacher or a nurse or someone even knows a child who may be ill, they now can be seen by someone, through a telehealth visit, through any visits possible at their doctor, they can get cleared to come back. What we're doing is we're really even reducing not only just the community risk, it's just, let's say it's a 3%, just say 3% incidence, you're now even screening kids at a lower incidence to be out of school. So we're now even dropping that ability. So I think schools have a unique opportunity, keep kids that are sick out, keep kids that are healthy in, and reduce that chance.
So you talked about your sort of student check-in tool, right? That kids can use before they come to school. How does that work?
Well, looking for the signs and symptoms of COVID, for knowing cough, shortness of breath, fever, unless there's some other underlying issue like an asthma or something that we know that may be caused. Those are the symptoms that we need to educate families and parents. That's a stay home. Let's continue the education from home. Again, the nice thing is, thank goodness children are being so mildly affected. Obviously, we've heard other cases of the inflammatory disease, et cetera, but we keep those kids at home, communicate to families, educate families, and continue that so they can make sure that they're supported at home as well, socially, medically, and educationally, so they're prepared to return to school and they feel better.
So we check them in at the door and we ask questions. Like how do we physically do this?
Let's check them in before. Let's check them in even before when they wake up in the morning. We all have phones. We all have the ability to text, to message. So school's already doing it with their blasts. So how can we get that information? If your child has these symptoms, stay home, see your doctor. If they don't, check yes, let's come back to class.
So does Hazel have a tool where is this one of the tools you're giving to districts where every family checks in every morning?
Today we have Hazel at home. Today we actually have the ability to, in every district that we work with, we actually have a connection to a provider today. We are working, that allows them to use their phone, use their child's Chrome, go by phone, by telemedicine visit, so by video visit, or even by text. So we're trying to reach families as easy as possible on their level to get that information. Today, we're working on that checklist to see, but again, since school hasn't started, we haven't gotten the feedback yet, but we're working every day with our schools on what is that best messaging. Because we want to work with the right schools. Every school messages schools differently.
Well, stay in touch with us because, hey, we have some really good family engagement messaging partners in our universe. I think our district leaders would love to help you sort of tweak this and pilot it, particularly because some are starting this summer. Some districts have decided to spread out the year and they're going to have kids in to do distancing. But this would be pretty groundbreaking if you all can figure out how so that the district can message out, and so every family has to basically check in the morning in order for the kid to be allowed to come to school. And if you have not checked in, then when you show up to school, there's probably like a triage to be checked in or something. If that's something that you can help a district pull off, I think, that's something that our folks will want to talk to you about.
It's going to be a partner effort, without a doubt. We need all the partners. It's a team effort on every side.
Yeah, that's a lot less scary than telling them they have to have teachers wearing PPE. Imagine a first grade class,
Without a doubt.
So I know everyone's our folks are all working on disinfecting plans, and they're looking at putting in plexiglass and and they're looking at reworking. Have you thought at all about some of the kind of like fun stuff about school that makes it so great that possibly can still happen somehow, like soccer games and, like I did a virtual field day relay with my kid on video and, it was like, yeah, good for her. But she didn't get, like, are there things that they can do with each other somehow at school? What are things that they might already have been doing that they could continue to do? We got to give some ideas for maybe some positive things that they can do.
Kids need to play. I mean, this is their force of learning is how to play and interact. And you're totally right. Number one, they're 100%. This is such a hard time mentally as well as physically for these children. So, having that ability, to reach out, and again, that's what the easiest possible way. I need to call someone, I need to talk to someone, I need to video someone. They're doing it already with their social media, but how do we get some healthcare professionals through there? So that's one thing we're working with schools on. You're right, at school, kids are going to find a fun way to play. I've heard great ideas from other pediatricians of, shadow tag, right? A way to still run and still maintain non-touching and social distance. Kids will find a way, and teachers are amazing at inspiring children on what to do. So I'm confident they're going to find the right way. I think the key go ahead.
School sports.
School sports, school sports has been a unique topic because we're trying to get children to play, to obey social distancing. I've heard everything from football teams allowed to play to people suspending seasons. It's going to be, again, the social distancing, the testing, the making sure childs can play together. We're already seeing in college football. So I think as we work with schools to develop that plan, we're here to find the right partners, find the right testing, and again, find the right community resources so that if they need to get all cleared to play, we can hopefully connect them to the right resources.
What about busing? Buses are a big thing that, are there strategies out there that they can use aside from hosing everything down all the time? But, is there stuff that kids can do when they go on buses to try to reduce spread?
Yeah, again, it's that spacing, and it's going to be that ventilation. We're looking at rooms even just for the health clinics. Making sure they're well ventilated, making sure they have the right windows. So for buses, 100%, they're going to have to be well ventilated, wiped down, masked, as kids are going to have to be masked at the appropriate age. And that's, and again, most importantly, it'll probably be a health check before they even get on, because if a bus full of healthy kids that are well spaced with ventilation will help the community versus any child that's identified as sick or non-ventilated or non-masked.
And then last, can we talk a little about the mental health aspect of this? Because I think you're going to have, you're going to have a few different things here going on. You're going to have the trauma of not having been in school for months. You're going to have just sort of the fear. There are going to be a lot of scared parents who probably pass that along to kids. What strategies or ideas are you thinking about to help kids with the mental health aspect of this?
Huge issue. Thanks for bringing it up. Again, we've always been committed to reducing all barriers to care, and so what we found today, this last few days, we had a child at home who actually reached out to us, and we were able to reach out through the parent, communicated a lot of social issues and mental issues for being apart, being apart from families. I mean, not family, but friends. And this was actually someone who was actually, in school. And so, the nice thing about us and our partnership with the schools, we go through all the district health policies, from mental health to pink eye to cough, so all those issues, especially mental health. And I'm actually now in talks with that head lead at the school, and we're using wraparound services both at the school and the community. So with our plan is really, anytime we launch force with the school, we get all those lined up. So it's actually quite easy. If a child has an issue and they're coming to us either at home, they're coming to us at school for another somatic issue, the nice thing is we can quickly wrap them around, and again, leverage technology to make care easier, reduce that barrier. By the end of the day, that counselor, social worker knows, so we can get to that child, make sure they have the right resources. So that's our best goal. So give us the warmest handshake to those community sources that the children are going to need.
So the guidance counselor and social worker in the school can use their connection to Hazel to get access to mental health professionals for individual kids, right? That's basically how it works.
Exactly. Yeah. Knowing the resources in town, connecting both locally as well as school, as well, and if they need to upgrade to local, that's been our always goal. Make sure the kids get the right care when they need it, and make sure that they don't have any barriers along the way.
Okay. Well, I think the big takeaway from this that is really giving some hope is that it seems that Hazel's ready to kind of roll your sleeves up and sit with some of these educational leaders and help them strategize and figure out ways to try to bring some normalcy back while also figuring out a plan. And I think there's going to be an interesting tipping point here when districts I think some districts are and being pressed by their communities and elected leaders to plan to have every kid on campus, and like go full steam ahead on that, while others are saying, you know what, we can't do all this stuff. That's not going to happen. And then, you have different, like kids in rural districts have to be on buses a lot longer whereas kids in urban districts can maybe just not do buses for the year, right? So every district's different, and I appreciate that you all have a sense of wanting to help and be partners. And so I think our members may take you up on that if you're willing to have those discussions.
Well, thank you, Doug. We love to learn, and you're 100%. Every district's different. Every child is different. So, how can we make sure that we get that right care for each person? And you're exactly right. The right roadmap for success for every school and district.
Great. And so to the IEI members out there and to anybody listening on the podcast, you can find, we'll be sending to our members, we'll send the detailed responses from Hazel out to your questions. And then the public can find on the hazel.co website, you can find their blog where they'll be posting these responses. So Dr. Rob, thanks for the time. Appreciate you being here, and hope we'll talk again soon.
Ditto. Thanks again.
Cheers.